Hello and welcome, everyone. I'm Kristen Schwartz, a licensed midwife and one of the MCs here at Gold. Welcome, everyone, to Gold Learning. And I'm here today with Gretchen Becker Crabb, and we're going to talk about her upcoming presentation. But first of all, welcome, Gretchen.
Thank you. Thanks for having me.
Welcome back, I should say. You're back here by popular demand.
I love
Presenting
it.
this time for our Gold Neonatal Conference in an add-on package that I'm really excited about. The package itself is called Protect and Nurture Developmental Care for Neonatal and Neuroprotection in the NICU. I'm going to talk about your presentation in just a moment. So, Gretchen, first of all, you are a occupational therapist, lactation counselor, infant mental health therapist. You're wearing so many wonderful hats. So tell us a little bit about your background.
Yeah. So exactly that. I became an occupational therapist and practiced for about 18 years, and then realized that I just needed more. And I had worked a lot in sensory integration and feeding. Which led to me becoming a CLC. And in the work that I was doing with parents and infants and children, I really developed a passion for the mental health piece as well. So a lot of the work I do is I think that different professions talk about things in different ways, and I think that we're actually all really talking about the same thing. So it's fun to be able to bring all of these worlds and these concepts together in my work.
Oh, yeah, bringing it all together and having this truly holistic approach to things, right?
Yeah,
And that must be
yes.
helpful also when you work with other professionals, because you know you yourself has to have different aspects, and different backgrounds there. So you can probably also communication will probably be good in that way as well.
Yeah, yes, yes.
So your presentation is called Breastfeeding as an Essential Component of Developmental Care in the NICU.
Mhm.
So really fascinating. Most of us are aware of how beneficial human milk is
Mhm.
for little ones in the NICU,
Mhm.
but it seems to be there is more to it. So, what is here the aspect of developmental care and breastfeeding? So can you give us a little bit of an overview there?
Yes, yeah. Feeding is just so much more than the actual active feeding. It's cultural, it's social emotional, it's physical, it's all of those things. And I think that really in this presentation, we talk a lot about how we as providers show up, but also how we can know our backgrounds in order to be able to support families, see the families that are in front of us, and then kind of bring in some of these other aspects of feeding into the work. And so thinking about different positions for feeding, or what are sensory and different motor aspects of feeding that come into play that we may not always consider when we're thinking about lactation or feeding in the NICU.
Mm-hmm. And feeding in the NICU, I mean, that brings with it a whole set of other challenges, right? There
Mm-hmm.
is often, the little ones are there, and they are often there's hoses and
Yes.
machines beeping, and there's a lot going on. Lots of interventions are taking place,
Right.
and procedures, and the parent as themselves are still, recovering from birth themselves too.
Mm-hmm.
So
Mm-hmm.
there's a lot going on, right?
Yeah.
And so talk a little bit about that aspect. What about this is, tricky in the NICU, and where does the developmental care part also comes in here?
Yeah. So it's complicated, right? Because
Mhm.
just by virtue of having a child in the NICU oftentimes changes the beliefs of the family and what the family was expecting. So there may have been significant trauma for that family coming into the NICU, and sometimes the trauma can be not expecting to be there at all.
Mhm.
And so I think that recognizing that, but then also, the NICU is also a place where, for good reason, there are life-saving measures that happen on a regular basis, and parents are often feel out of control, or they don't feel like the experts on their children. And that can happen very quickly. And so thinking about lactation and breastfeeding as a developmental as a way to be able to promote development and of the social emotional dyad or triad, um, and thinking about how that also can relate to how we can share with families how like feeding at the breast or the body can have like lifelong impacts for that child, how it changes the dynamic and the trajectory.
Mm-hmm.
Has
Yeah,
the
it's not just,
opportunity.
as you mentioned before, the human milk, the breast milk, and the components, but there's also so much to it. You talk about reflexes, right? You're talking
Mm-hmm.
about smells and scents and all that goes in there. I can only imagine how important and beneficial this is also for brain development,
Oh, absolutely.
motor development as well, right?
Yes, absolutely. And again, like I feel like in the NICU, there's um, this is something that parents can do,
Mhm.
where they may not feel like they can do very much at all, but this is sometimes like, right. But this is oftentimes skin to skin, or involving parenting cares and involving parents in different ways to be able to creatively feed is a part, and having them be a part of that team is a huge part to the healing process for them as well.
Absolutely. Yeah, so well
Yeah.
said. Gretchen, what tip can you give for somebody who's working in the NICU who is looking at this going, yeah, that sounds all nice, but what can I do here now? I'm
Yeah.
already very busy. We all, are understaffed and it's a lot going on. But what
Mhm.
can you tell us here? How can this be implemented or what steps can be taken?
Yeah, I think there's a lot of things that can be done. And I think that one of the most simplest things, one of the most basic things that we can do is, and I think Kristen, you just said, like, it is a very busy environment. It
Mm.
is very fast paced. And I think that sometimes just even sitting down with a family and sitting down next to them and saying, what is this like for you today? You
Mhm.
know, slowing the train down a little bit and saying, how, what's important for you in feeding? What would you like to see? What do you need that maybe feels
Mhm.
different than what's happening here? But it just, and it doesn't take all day necessarily, but it may just be 5 minutes of just being able to sit next to a family and
Mhm.
hear them, or even just to sit with them and not even say anything at all sometimes. I think just presence um, and being there and being curious about what a family's experiences are can be one of the most beneficial things that we can do for
Mm.
families.
I like this so much because, it is so true because the most of the focus, of course, is on the infant in the
Yes.
NICU, and
Yeah.
for good reason, as you mentioned. But the family is there, and often nobody asks them, so how are you feeling? How are you
Hmm.
doing?
Hmm.
And often, and I know you speak about this as well, that they often feel this is not even their baby. Nurses often say, "Oh,
Right.
our baby's our NICU baby," so
Yes.
they feel like
Yes.
so, that they're not being able to parent their child, because they feel too scared. They don't know what to do. They think
Right.
it's so fragile. They don't want to do anything wrong, right? And
Right.
often nobody is really asking them, so how are you doing? What is going on for you? How do you feel about, especially how do you feel like, how's this experience for you? And about
Hmm.
feeding and
Yeah.
that as well. I like this so much.
Yeah, yeah. And I think it's sometimes the most complex situations evoke some of the simplest interventions. Like sometimes simple can be so powerful, right? Like,
Right,
and
right.
so I think that, pausing with families and wondering with them about what's important for them. How did they expect feeding to go in pregnancy?
Hmm.
How is that the same or different than what they're experiencing in the NICU? Also allows us it not only allows the family for the opportunity to share their input and give their perspective and feel heard, but it also, as providers, gives us a little bit of a glimpse into what the family may need, and it helps us to like hone our resources in a way, that takes it like I might think as a provider, oh, this family needs X, Y, Z,
Right.
but family might not need that at all. And so like I think that it allows us the opportunity to be able to really see the family for who they are and what they may need that day and moving forward.
Beautiful. Yes, and it makes so much sense. Gretchen, before I let you go here, final words from your side. What are you hoping our viewers will take away from your presentation here?
Yeah, I'm hoping that that we can have the opportunity to see how rich the feeding experience is and how multifaceted it is. How even just something as simple as how we might touch or interact or position an infant or a family or that parent can have profound impacts on their well-being, on the infant's growth and development, but also that growth and the development of the family as well. I also hope that as part of it, there's parts of our presentation where we allow for some opportunities for self-exploration for you as the provider, so that you have the chance to do what we were just talking about with families, to pause and reflect around what feeding and what providing this care means for you as well.
Thank you so much, Gretchen. That sounds absolutely wonderful, and I can't wait
Thank
to
you.
watch your presentation.
Thank you.
And now some information for our viewers. The presentation Breastfeeding as an Essential Component of Developmental Care in the NICU is part of the brand new lecture pack that we have available here very soon. And the title of the lecture pack is Protect and Nurture, Developmental Care for Neonatal Neuroprotection in the NICU. This is an add-on package for our Gold Neonatal Online Conference. We get started June 3rd with our open access keynote presentation by Dr. Niels Bergman on skin to skin. And I hope everybody will join us for this keynote presentation. Check out the conference. And of course, there's a lovely lecture pack here as well, where Gretchen is part of. Thank you, Gretchen, for being here today. And thank you to
Thank
all
you.
of our viewers. Bye-bye.